This conference will now be recorded.
Hi, I'm Jean Shumway, and this is the second in a series of videos for the PICO Library Lab for evidence-based practice. And in this video, I am going to introduce you to PICO and the evidence-based practice process with PICO. So what is evidence-based decision making? It is basically taking a number of factors into account when you make a decision. One of which is research, which is what we're going to focus on in this video. Another is evidence from assessment of the patient. Another is the clinician's personal expertise. And the third is the preferences and values of the patient. So all of those feed into decision making. And again, what I'm focusing on today is the evidence from the research and how to get that. So here are the steps in there are 6 steps in the evidence-based practice process. First, you ask a clinical question, then you collect the evidence, then you critique it, you integrate it into your practice, you evaluate it, and you share your outcomes. So we're going to look at the first 2 of these steps. Now, the next question is, what constitutes a good clinical question? You're going to be coming up with a problem and then creating a question from that problem. It's basically a research question, but we call it a clinical question. So when selecting a clinical problem, ask yourself the following questions. 1, is it a concern that is relevant to nursing? You want to make sure that it's not a medical question, that it's a nursing question. 2, is it a concern that someone else has likely studied? So you want to make sure that you're not too narrow or you're too current in your topic. You want to make sure that there's literature about it. And 3, is it a concern that can be measured or described? So some questions that can't be measured very easily, so you want to make sure that it's measurable. So here's an example of a poor question. For children with minor head injuries, how effective are neurological tests for diagnosing intracranial hemorrhage compared to CT scans? And while this is a good narrow question, it is not a nursing question, it's a medical question, so this wouldn't work for this assignment. Here's another poor example. How can I help with my young diabetic patient feel better? It's too vague. While it is a good nursing question, it's not specific enough. You need a more specific intervention, and you could be more specific in your population. And here is that question rephrased to be better. So what is the best patient teaching method? So that's your intervention, more specific intervention of newly diagnosed adolescent diabetic patients. So there's a more specific population treated at ambulatory care clinics. So this is a good example of a good question. So let's go through the steps of the evidence-based practice process. And step 1 is to start with a clinical problem. And this usually comes from clinical practice. It often will come from certain patients where you identify problems. And then a good way to start out is just to write a paragraph in your own words describing the clinical problem. And this can help you to focus and to work out really what your question is. So here's an example of a clinical problem. Residents at a retirement center have been asking why it is important for people their age to get an annual flu shot. Does it reduce the risk of acquiring pneumonia? So that's a really succinct problem. Yours is probably going to be a little bit longer paragraph describing it. So step 2 is problem clarification. Talk about the clinical problem with other healthcare professionals. Think about it in terms of questions like who, what, when, where, why, how. You might need to tweak it to make it a better problem to focus on. Then step 3 is to focus it using PICO. So let's take a look at PICO. PICO model stands for Population Intervention Comparison and Outcome. Let's take a little deeper dive into each of these elements. So P is the population. This is the patients of interest. It is not one single patient, but a group of patients. And you need to think about what are their most important characteristics related to this specific problem, such as what is their major health concern, or what's their age, or what's their sex. What is most important to make them as a group related to this problem? In my example, my population is adults age 65 and older in a retirement center. Intervention is your interest area. This is the most important part. It is next to the population. It's what you're studying, what you're interested in. What are you planning to do? So my interest area or my intervention is an annual influenza vaccine. You do not have to have a comparison, but if you do, it is something that it's comparing to your intervention. So you might have 2 different procedures, 2 different drugs, 2 different training methods, that sort of thing. And mine is no influenza vaccine. And then your outcome is what are you looking at that you hope to accomplish, or what do you think might happen? And mine is, my outcome is I'm hoping for a reduced risk of acquiring pneumonia, or my hypothesis you might be. So here is a sample. Here's my question. My residents at a retirement center have been asking, why is it important for people their age to get an annual flu shot? Does it reduce the risk of them acquiring pneumonia? And my PICO, my focus PICO, is residents age 65 and older in a retirement center. My intervention is an annual influenza vaccine. The comparison is no vaccine. And my outcome is reduced risk of acquiring pneumonia. So once you have your PICO, you need to condense it into a single question. And your PICO question needs to have all of the elements in a single question. So all of the PICO elements. And a good way to do that is with this format. You start with the population, you tag on the intervention, then you add in the outcome and then the comparison. So we have for residents age 65 and older in a retirement center, adding the intervention of how effective is an annual influenza vaccine, then add in the outcome in reducing the risk of pneumonia. And if you have a comparison, you just tack that on at the end, compared to not getting the vaccine. This method, starting with 4 in the population, usually works. There are some questions it doesn't work for as well. Just make sure you have all of the items, population, intervention, outcome, and if you have a comparison, the comparison in your single question. So here is my question. So why take the time to do this? Well, it's going to help your research. It's going to improve your results. You're going to be more focused. You're going to be more efficient. You're going to be more systematic. You're less likely to go down rabbit holes. You're going to be more focused. It will also help you have search words, and that will improve your searching. So that concludes this video. Make sure you watch the next 2 videos. One will be on searching for books, and the other one will be on searching for articles.